Hello, this is Anuja Matthew. It's November 27, 2020. Today I'd like to talk to you about what people around the world think about COVID vaccines. I would like to discuss three charts taken from an article written in Business Insider on COVID vaccines. This was a survey done in about 20,000 adults between 16 and 74 years of age across 27 countries. I'm a little surprised by some of the results. The first chart shows the interest in getting a COVID vaccine if available. So what's a little surprising to me, there's quite a bit of difference across countries. For example, in China, 97% of the people who were polled either somewhat agreed or strongly agreed that they would be interested in getting a COVID-19 vaccine if it was available. In contrast, in Russia, about 53 to 54% of people showed interest in getting a COVID-19 vaccine available, and about 50 or 48% then showed no interest or either disagreed or strongly disagreed that they would get a COVID-19 vaccine if available. The United States stands at about 67% interest in people getting a COVID-19 vaccine if available. In the next slide, this shows reasons why people were not interested in taking a vaccine. So this is also somewhat interesting. Most people seem to be worried about the side effects of taking the vaccine. So will the side effects be too severe that they would not be then interested in taking a vaccine? Many people, about 30% to 40% of people, didn't think that a COVID vaccine would be effective. So that's cause for concern. So even though there are vaccines that will be shortly available, if people are not confident that it's going to be effective, then you would have a small minority of people taking the vaccine, which is a huge concern for vaccine manufacturers and general public health specialists. And a certain subset of people don't feel that they're at enough of a risk from COVID-19 to want to take the vaccine. And then a subset of people don't like vaccines in general. So the last slide really is, how do you anticipate if a COVID vaccine will be available to you in 2020? So I would just like to mention that this article or this survey was published on September 2nd, 2020. So this is before the results of the phase 3 trials that I'm going to talk about next came out. So many countries did not think that a COVID vaccine would be available in 2020. However, countries like China, over 90% of people or 87% of people said that they anticipated that a COVID vaccine would be available in 2020. In contrast, in Poland, only 20% of people thought that there would be a COVID vaccine available in 2020 to them. In the last 2 weeks, 3 companies, Pfizer, Moderna, and Astra Zeneca, have all provided news releases that show that their vaccines, COVID vaccines, are effective. So I just want to go over the 3 vaccines and talk a little bit about a phase 3 trial. So all of the 3 companies plan to enroll several thousand people in their trials. The planned enrollment were approximately about 30,000 individuals. So about 15,000 individuals got a placebo. So a placebo would be either PBS or saline, and then 15,000 people got the vaccine, got either the Pfizer vaccine or the Moderna vaccine. And I would mention that both the Pfizer vaccine and the Moderna vaccine are mRNA based. And if you want some more information on the types of vaccines, please go to my previous lectures. I have at least 2 or 3 lectures on COVID vaccines. So they are both mRNA based. About 15,000 people got the vaccine. For both the Pfizer and the Moderna trial, they got 2 doses of the vaccine. So in a phase 3 trial, because it's an efficacy trial, you want to know whether the vaccine protects you from natural infection. So they have to be administered to people where there's natural infection going on. So for example, when they planned these trials, they decided to have multiple trial sites. So, for example, the Pfizer trial has about 150 clinical trial sites all across the world. The Moderna vaccine has about 100 clinical sites all across the US. So, the hope to show efficacy is that some people in the vaccine group and the placebo group, there will be illnesses, and the ideal vaccine will have all the illnesses be in the placebo group, because if the vaccine was effective, then it should protect you from getting sick. So these are the summary of the news releases. So they have not published the data yet, but I'm anticipating it will be published soon. But in the news releases, both the Pfizer and the Moderna trial had about, in the case of Pfizer, they had about 170 confirmed cases of COVID-19. When they then unblinded the study, they observed that 162 out of the 170 people that got COVID-19 were in the placebo group, versus 8 were in the vaccine group. So the vast majority of people who got COVID were people who got a placebo. That means they didn't get the vaccine, compared to only 8 people in the vaccine group who got ill. There were 9 severe cases. As many of you know, there's a wide range of symptoms. So people get either asymptomatic, have very mild symptoms, or then can develop moderate or severe symptoms. There were 9 severe cases of COVID-19 in the placebo group and only 1 in the vaccine group. So this is looking really good. They had a wide range of ages, ethnicities of people who were immunized with the vaccine. Side effects were seen, and most of the side effects appeared to be fatigue and headache. And as mentioned before, this was done all across the world. In contrast, Moderna also had a very high effectiveness for the vaccine. 95 confirmed cases of COVID in the group. 90 of them, of the 95, were given the placebo, and 5 had received the mRNA vaccine. If you look at terms of severity, about 11 severe cases of COVID-19 showed up in this trial, and all 11 of those cases were in the placebo group. And there were about 100 clinical sites across the US. The third vaccine is the Astra Zeneca vaccine. This vaccine is based on an adenovirus vector. People were administered 2 different dosing regimens, and when they unblinded the study, both regimens demonstrated efficacy, with one of the regimens showing better profile. It's a little bit complicated, but as they stated in their news release, there were no hospitalizations or severe cases of COVID-19 in participants who received the vaccine. This vaccine was primarily administered to people in either the UK or Brazil. Moderna and AstraZeneca waited 14 days following the second dose to begin counting cases of COVID, while Pfizer waited 7 days. Most of us get a number of vaccines. There are vaccines that are highly effective that include, say, tetanus or Ebola or even rubella. There are some vaccines that we get often. So the flu vaccine, it's recommended that we get the vaccine every year. And the flu vaccine ranges between, say, 35 and 65% vaccine efficacy. So the COVID vaccines, when they started out, they were expecting in that range between 50 and 70% efficacy. So the interim results from the phase 3 trials from all 3 vaccines that have just recently come out are very encouraging. Most of the results show that they're about 90 to 95% effective. There are still, however, a number of considerations to be made and things to think about if this vaccine is going to be effective. And as discussed in the article that did a survey on people around the world, people need to be confident that we have an effective vaccine. If people are not confident, they're not going to get the vaccine. What points should one consider when thinking about COVID vaccines? The first and most important point, I think, is the vaccine safe? Is it helpful? Is it unhelpful? Or is it actually detrimental? So there have been examples of all 3 where vaccines have been effective, not effective, or actually hurt or been detrimental. So the preliminary data suggests that the COVID vaccines are effective and immunogenic. The next thing to consider would be, are there major side effects? Typically, when one receives a vaccine, people feel fatigue, they have headaches, There's some anecdotal evidence to suggest that there might be some significant side effects where people don't feel well for 2 days or 3 days, and that might be very dependent on the person getting the vaccine, what your history of other vaccination has been. The next thing to consider is, do I have to travel far to get a vaccine? So both the Pfizer and the Moderna vaccine require cold storage, and they have to be stored at very cold temperatures. So this will not be available, for example, at your doctor's office, and particularly say in rural areas where there's no access to cold facilities. People might need to travel far to go get the vaccine. So that is a significant consideration. Can the public health officials convince people, for example, to drive an hour to the nearest hospital to get the vaccine? And as I mentioned before, all versions of the vaccine require 2 shots. So will you go in for the first shot and then not be as thrilled about getting the shot and then forget the second shot? And then that really doesn't bode well for you getting an effective vaccine. So are you prepared to go in at a spaced interval and get 2 shots, especially if you have to travel a decent distance to get the vaccine? And who really does get the vaccine first? Is it going to be equitable? Are specific countries going to get one version of the vaccine versus another? Furthermore, within a country or within states, are people going to get different versions of the vaccine? Who most likely people at high risks, which would be healthcare workers, public health personnel. The elderly would be the first wave of people getting the vaccine. And following that, are young adults next on the line? Are healthy adults next on the line? So all of these questions still need to be answered methodically and carefully, and we need to have enough doses for it to be a valid proposition. As an immunologist, I think of a few other things. Is the endpoint or the primary endpoint prevention of symptomatic COVID, and how do you define symptomatic COVID? So does the vaccine only protect against mild COVID, or does it also protect against severe COVID? And that's something that needs to still be determined. The interim analysis sounds like it protects mostly for mild and moderate COVID. Severe COVID cases were less than 10 in both the trials that had results out earlier this week. And most importantly, how long does immunity last with the vaccine? So it's only been less than 2 months in many of these individuals that had vaccine administered. So 6 months from now, is the vaccine as effective? And I think several of the trials are following individuals out up to 1 or 2 years. So we will know that answer. We don't know that yet. If it's only effective for 2 months and it's not effective 6 months from now, then we'd have to really rethink, would that really lend confidence to people that they would go in and get a vaccine, a COVID vaccine that's only effective for 2 or 3 months? It might be that we now start getting COVID vaccines every year along with flu vaccines. That's all yet down the road, but that's one thing that immunologists are highly interested in knowing. How durable is immunity? Do both arms of the immune system, that's antibodies and T cells, last a long term in individuals who've received these different kinds of COVID vaccine? What about people who've already had COVID? Is getting a vaccine going to help boost the natural infection you have, so it actually is a good thing, or will it make it worse? So there's conditions where it might theoretically make it worse. That's yet to be known. And also, will the vaccine safely protect children? Many of the results that have been published to date have been in subjects 18 years and older. They might be doing trials in children, but that's yet to be known. So there's a lot out there. The data are very encouraging. It is good news. The speed at which vaccine manufacturers have gotten a vaccine out is incredible. So this is good news, but I just wanted to mention the things that you need to consider when trying to get a COVID vaccine. So thanks again for your attention. This is Anuja Matthew. It's November 27th, 2020, and this is a lecture on what you need to think about if you want to get a COVID vaccine. Thanks again.